All right, good evening, everybody. On behalf of the Sclera Lens Education Society, thank you for taking the time to join us tonight. My name is Rob Ensley. I'm the treasurer of the SLS, and I'll be moderating tonight's panel discussion. Before we get started, I wanted to remind everybody that if you aren't a member of the SLS yet, you can sign on and become a member. Membership is free, and it gives you access to a bounty of resources from our archived webinars to various resources like journal articles and other information that you can disperse to patients. I'd also like to remind you guys that there is going to be another webinar next Wednesday at 8 o'clock Eastern time, and that will be Scleral Lens Troubleshooting. So that'll be for the novice fitter. So that should be worth tuning into if you're still easing into fitting sclerals. Tonight we'll be discussing some tips about building up and managing a scleral lens practice with our panel of experts, which include Greg DeNaeyer, Stephanie Wu, and Caitlin Morrison, who all have a wealth of knowledge. They've built up their practices from scratch, and they're all fellows of the Sclera Lens Society. So feel free to shoot any questions you may have either through the chat or Q&A function down at the bottom of the screen as we go along, and we'll do our best to answer. I think we have a lot of students on the webinar tonight, and so the general theme applies to the students, but also to anybody that's new fitting scleral lenses, which is now what? And how do I get started with fitting scleral lenses, as we get going? Because in my practice, we have student externs, and I feel like most of them all have a pretty decent grasp on the fitting process itself, but they're not always in tune with what the process entails, from finding the patients to managing them as they go, what supplies, what information is needed to disperse, and then how to manage them long term. So that's kind of the theme that we're going to go with tonight. So while I have our panelists introduce themselves, I have a little poll. If you could answer that, that'd be great. And then we'll go ahead and just get started. So we'll kick it off with Dr. DeNaeyer.
Oh, I think you're muted.
My name is Greg DeNaeyer. I'm an optometrist in Columbus, Ohio. And I work at an anterior ophthalmology practice, which I have for the past 21 years. And when I first started out, we had 3 cornea specialists, and I was fitting a lot of patients with keratoconus, patients who have had corneal transplants, basically corneal irregularity. And this is around 2000. And back then, scleral lenses weren't at all popularized. In fact, there's just a few people probably around the country that were fitting them. And so I was using corneal GP lenses exclusively. And I was challenged many times where I was having difficulty getting those lenses to center properly on the eye. In fact, sometimes I wasn't successful with that. And I had been discussing this with a colleague of mine, and he mentioned something about scleral lenses, and maybe I should give that a try. Well, I had to investigate what scleral lenses were, and I ended up getting a diagnostic set out of Texas called a company called C&H Contact Lenses. And that lens is a precursor to what was then termed as the SoClear lens. And so I ordered this diagnostic set to the practice. I got it. I had absolutely no instruction, no training at all how to use it. And I had a patient, and I got the fitting set out, and I put one of the lenses on the eye. In fact, I didn't even fill it with solution because I didn't know that you had to fill the scleral lenses with solution. It must have been flat enough because it somewhat worked, but I still remember the fact that the lens centered on the patient's eye, and without me doing anything. And I think from that point in time, I knew that I wanted to pursue scleral lenses as something I could utilize in my specialty lens practice. And 20 years later, here I am.
Stephanie?
Yeah, thanks, Rob, and thank you to the Scleral Lens Society for having me. This is such an honor to be here. I'm obviously, the SLS is very near and dear to my heart. And yeah, so I completed a cornea and contact lens residency in Missouri. And then after that, I went back home to Arizona where I joined up with a practice that had zero specialty lens patients. So it was mostly primary care, lots of medical exams, post-op cataracts, things like that. So just kind of a normal private practice. And I was determined to have specialty lenses become a part of the practice. So I single-handedly developed the specialty lens portion of the clinic. And after about 5 years, we had over 1,000 patients.
Dr. Morrison?
All right. Hey, everyone. Thanks for having me. My name is Caitlin Morrison, and I own a private practice in Scottsdale that specializes in scleral lenses, anything specialty contact lenses. I got involved in specialty contact lenses and scleral lenses specifically when I was a student. I always had a hard time wearing contact lenses because of my dry eyes, and so I've been a happy scleral lens user for many years. I completed a cornea and contact lens residency at SUNY and spent the next couple years at New York Eye and Ear in the cornea department doing prosthetics and different types of lenses and just some pre and post-op anterior segment cases. And then moved home to Arizona just as Stephanie was moving out and just started my practice. And Greg, I can't believe you are 20 years into practice. You don't look that old. You look too young.
Well, great. So now that the introductions are out of the way, let's just go ahead and start talking about the first thing that obviously we all need to fit scleral lenses, which is patience. And so, Greg, I know you're in an ophthalmology practice as the optometrist that's fitting lenses. So you briefly touched on it, but how'd you go about, building up your patient base? And when you first started, were the ophthalmologists in your practice receptive? Did you have to prove the concept? And then how have you gone about building your practice in the local area now?
Yeah, so I'm lucky that in my particular practice, it's anterior ophthalmology based. We have 3 cornea specialists, and that you should recognize as a major pipeline, no matter what type of practice you're in for referrals. A lot of these patients get filtered to the cornea specialist, a lot of keratoconus patients, a lot of patients obviously that they'll end up having transplants by these physicians. And so I'm lucky that those practitioners are right here in my practice. Again, my start was 20 years ago, and our ophthalmologist didn't even know what scleral lenses were. And it took quite a bit of time, actually, and education on my part to help them to realize that this is something that could really help their patients out and make a big difference. And that does take a little bit of time. To your point, Rob, it's what really helps in that process is just proof of concept. So as they started sending me patients and we were having tremendous successes, that went a long way, especially on an ophthalmologist side. When they're not fitting scleral lenses, they're not utilizing lenses, they will have patients that they have to see quite frequently, quite often. And despite medications in the cases of ocular surface disease, despite transplants, despite surgery, sometimes the ophthalmologist is at the end of what they can do to help the patient. And that's where you come in. And it's really an awesome feeling to be able to be the individual, the practitioner that is the last piece in that puzzle for the patient and gets them to really be able to utilize what vision they have left. from there in my personal practice, about 50% of my referrals are from our cornea specialist. About 25% of my referrals now are actually from local optometrists in town, and certainly that's a significant source. But it took a long time to get those referrals, because I think especially optometry, we're not used to necessarily referring to other optometrists, although that's maybe becoming a little bit more common. But as I just became more successful with this, as I got to have a reputation in Central Ohio, in Ohio, then I had more optometrists starting to refer to me. And then the last 25% of my patients either come, oddly enough, from patient referrals. I mean, I think you'd be surprised at how many keratoconus patients know each other, even in their local areas, as well as sort of a combination of the website as well. And I know that we're going to talk a little bit more about that. But one thing I want to stress as far as my part in tonight's webinar, if you take anything that I have to say, is that we're now in a climate where scleral lenses have really become mainstream. And it's not just the specialty lens fitters out there utilizing them. We have a lot of doctors in private practice and elsewhere that are utilizing scleral lenses. And so if you want to be really serious about scleral lenses, if you want to do more volume with scleral contact lenses, then you have to find ways to separate yourself from everybody else. And I still remember back when I was really excited about getting into this and I wanted to make a name for myself and get referrals and all that, is that I decided that even though I was slow, I was maybe seeing one scleral patient a week or maybe once every 2 weeks. I decided that every single day I would devote some part of that day towards myself becoming more of an expert in specialty lenses and scleral contact lenses. So it might be as little as take a picture of a patient that I might use later on for a website or a lecture, or start an article that I would submit to Contact Lens Spectrum, or start a lecture or something every single day. And you will be surprised that in a little bit of time that you will have a lot of stuff out there that will then separate yourself from just the average practitioner.
So Dr. Wu, I know, when you first came out of residency, you started in a private practice that had absolutely no specialty lens or scleral lens patients. And so you had to build that up from scratch. And then of course, can you talk about how you went about getting those external sources, not just from ophthalmology, but our optometry colleagues like Dr. DeNaeyer said, and then what sort of led you to choosing to go kind of down your own path with a specialty only clinic and how you built that up. And then Dr. Morrison, I think, could talk a little bit about that since she's doing the same thing.
Yeah, thanks, Rob. So when I first joined up with my clinic, I just knew that I wanted to incorporate specialty lenses into the clinic somehow, but I didn't know exactly how I would get referrals and things like that. So we did a couple things. First, we put an ad in the local paper, and it was a very small, very cheap ad in the paper, and it said something like, do you suffer from any of the following conditions? Keratoconus, corneal transplant, RK scarring, extreme dry eye with contact lenses. It was like a relatively short list of maybe like 8 things. Because most people that have keratoconus, if they are diagnosed with that, they know it. That's a word they recognize. So if they see that in the paper, they're like, oh, this doctor actually can maybe help me. And so that was the very first thing that we did when I moved into the practice, and we surprisingly got a lot of patients from that. Just people that maybe had tried other things or they had visited other doctors and not getting anywhere. So that was like one of the first things. It was simple and cheap. Putting it on the website. So adding things about scleral lenses, what are they, adding things about different eye diseases such as keratoconus, corneal transplant, what they are, and what kind of treatment options exist. That helps to drive patients into the practice. And then I did go door to door, and I met with every optometrist and ophthalmologist in the area, and I brought marketing materials. So just kind of showing them that I had completed a residency. I was very capable of helping some of these patients. And that was definitely probably my best resource, because when you have a face-to-face interview with, or not interview, but just networking, you know, going out to coffee. And I know Dr. Morrison has, we share lots of stories because we're kind of going down this road together. But kind of networking that way has been absolutely huge for my new clinic, because I'm only doing specialty lenses here in Las Vegas. But going back to the other clinics, just even talking to them and telling them this is what you can do and what you can help with, because there still are a lot of eye doctors that absolutely do not want to do anything with specialty lenses at all. I mean, they see a gas permeable lens and they're like, I'm sorry, I can't help you. So the doctors knowing that this is something that you can do to help them, I think was the absolute one of the best things. And then last thing would be my own patients. So I would see somebody for a comprehensive exam, and they were just coming in to, let's say, update their glasses, and they had RK scarring, let's say. And I'd say, okay, we've got your new glasses prescription updated. You're still seeing about 20/40, 20/50. And have you ever considered any other options to improve your vision? So just me taking that extra step to ask the patient a little bit more as far as questions go about if they were happy with their vision, does their vision fluctuate, things like that. That also drove a lot of patients into specialty lenses. So I would say in the beginning, that probably was my biggest referral source, was just from myself, all the regular patients that I saw, and I saw an opportunity where they could potentially see better. So those are probably the most important things that I took. And I know Dr. Morrison has some amazing tips on that too, because we've talked about it together a lot.
Yeah, so basically, Stephanie and I are kind of set up a very similar practice at the same exact time. So what we did, or what I did specifically, is I moved to Arizona to be closer to my family. I didn't have any connections here in terms of the optometry or ophthalmology world, but I knew I wanted to do specialty lenses only and make that my practice. So the initial thing that I did was I sent out a letter to probably 100 ophthalmologists in the area, just detailing this is what I do, and this is kind of a little bit of my background. This is what I could offer your patients. I made them very specific, so cornea ophthalmologists would not get the same type of letter as retinal ophthalmologists, retina specialists. And so if I found something in the person's bio online, the ophthalmologist bio, that I thought was kind of interesting, like, oh, we both, you know, worked at New York Eye and Ear or something like that, I would put that into my letter just to make it a little bit more personal. And one thing that I really tried to do with those letters, and then afterwards meeting up with a lot of the physicians at coffee or taking them to dinner, was I wanted it to be more like a friendship than a business transaction. So we have each other, like most of the people that refer to me, we have each other's cell phone numbers. When they refer someone to me or vice versa, I usually text them like, hey, I'm going to send you over a cataract evaluation. And that way, every time I send a patient, whether they go or not, they'll kind of know that I was thinking about them and really value their expertise, and hopefully they would think the same thing about me. And I got a lot of good responses from those. And so that was kind of the practitioner to practitioner. And then I also wanted to do a little bit of the patient to practitioner, just getting patients from, you know, someone looking you up online. So making sure your website has a lot of really good quality content in it is really important. And Rob just flipped to this page that all of you guys are going to get afterwards sent to you. Basically, it talks about one of the most important things I think you can do as a student or new grad or someone who wants to specialize and is interested in acquiring patients is, no matter where you're at, if you're at a hospital, private practice, If you set up your own personal branded website now, that having it now actually puts you higher on Google's rankings if you want to start your own practice in 5 years. So the website that I made as a fourth-year student, that gets actually more traction than my office's website now, just because I made it so long ago and it has a lot of information about sclerals, keratoconus, etc. It's really easy. You just buy a domain, you put like Dr. So-and-so or just your full name if you're a student, and you can change it later if you'd like to. And then just kind of put on it what makes you unique. If you're interested, like Greg was saying, if you're interested in scleral lenses and specialty lenses, if you see something in the clinic that is really interesting, take a picture, have the patient sign a release form, put that picture on your website and tell people, hey, look what I just did. This is a scleral lens patient who was fit really successfully, blah, blah, blah. 5 years down the line, when you're trying to open up your own practice, or even tomorrow, you're just going to have more content out there, which people will see you as somebody who, A, really is passionate about this, and then 2, can provide patients with the results that they want.
Great. So real quick, I want to go back to Greg. We talked a lot about referrals from other ophthalmologists and optometrists, but have you had any success gaining referrals from just other disciplines like rheumatology, oncology, just primary care? And then we'll shift back towards, what content we can put on our website, which also is another tool for referrals, which is how did you go about developing, your online education piece? So, blog content, patient education. I couldn't link everybody's website on here, but they all have really great information. So I'd encourage you to visit their websites for ideas if you wish. So, Greg.
Yeah, well, first of all, I really liked Stephanie and Katie's comments about essentially trying to make a personal connection with your referral sources, because it's great that you would send out a letter. That way, some of the people may read that letter, some may just throw it away, but sometimes you have to stay after people. And it can be, if they're already referring to somebody too, it can be hard to change people's habits. But if you stay after it, and I love that, the fact that if you make a personal connection, it goes such a long way. And I think especially as the days and years go on, you'll really reap the rewards from that. As far as other specialty services where you can get referrals, I haven't really had a lot of luck personally with that. I think because I'm getting them from the cornea specialist, that is taken care of in a way. In other words, a rheumatologist may send a patient to the cornea specialist because they have ocular graft versus host disease, and the cornea specialist or ophthalmologist may treat them somewhat with drops and some types of therapies, but they end up getting to me then for scleral contact lens fitting. But it wouldn't be a bad idea, especially for, I think in particular, ocular surface disease, is to court some of the other specialty physicians like rheumatologists, because those are the types of doctors that will be taking care of those patients. And the other thing too is as much as we know about scleral contact lenses, they've become really popularized in optometry and now in ophthalmology as well. There's still many other physicians, other specialists out there that would have almost probably no clue what scleral contact lenses were. So education still goes a long way, even with those subspecialists. On my website, which you can see there on the left as a screenshot, basically our ophthalmology practice has their own general website, which I'm on. But a number of years ago, I thought really I wanted to separate myself a bit from our practice. It's still connected, but just separated a bit, and created my own separate scleral lens site, which is called the Scleral Lens Center or the scleralenscenter.com. And I've had a couple iterations of it, but basically it's content that explains scleral contact lenses. There's a lot of keywords so that they come up in searches like keratoconus or graft versus host disease. But beyond that, and this gets back to putting yourself ahead or above other practitioners, because if you go to a lot of even private practitioners' websites, many of them now do have tabs for scleral contact lenses, and they have a lot of generic information about what scleral lenses are, who they can help. But I think, again, if you want to be serious about it, you have to take your website up to the next level. And so for me, getting back to, I've written, a lot of peer-reviewed papers and professional publications. So I list some of those on there. And so patients can click on those. And it really helps them to see you as someone who is an expert in what you're doing in fitting scleral contact lenses. And I also have on there some videos, some application removal videos. I have links to all, the important websites like the Scleral Lens Education Society. So I try to be well-rounded about it. I have a testimonial page so that, patients can go there and hear what other patients in our practice have said about our care and in what scleral contact lenses have been able to do for them.
So on a similar note, I think social media plays, an equally important role. A story that I had is I actually have a patient, I practice in Kentucky, that was telling me about an Instagram that she followed, and it turned out to be Dr. Morrison's. And so she was learning more from that social media, or Dr. Morrison's social media, than even from me. So that was, in a way, slightly humbling, but also eye-opening. But it just goes to show you the reach that you can have when, she is in Scottsdale and I'm in Kentucky, and my patients are finding her. So on that note, Dr. Morrison, I know Dr. Wu also does quite a bit on Instagram and Facebook, but I think slightly different approaches. So I'll let you two talk about how you guys utilize your social media, both on Facebook and Instagram, to not only educate patients, but also gain referrals, if any. So we'll start with Dr. Morrison.
Yeah, I would say that this was probably one of the most surprising things that came out of me starting this social media account a few years ago, was that I actually have acquired patients through my Instagram account, which is just wild to me. But patients from out of state who saw me, and I had even referred them to people in their area that maybe could help them with a very similar thing. And they decided, to wait to come to Arizona to see me when my practice opened. So that was kind of like humbling and a really cool thing that came out of my Instagram account. But the reason I started this a few years ago was kind of just to do an experiment to see, what do you do on social media? I'm not very tech savvy. And so this is very hard for me. I don't really enjoy social media too much, but I wanted to see how it worked and to make it useful for my practice, because I knew I was going to have a private practice in the future, and that social media would be really important. So my social media accounts, anything that I do online, including things on my website, I have decided to go with the approach of a practitioner to patient point of view. So a lot of the stuff that I post is layman's terms, interesting things that someone who doesn't know anything about the medical world would read and say, oh, that's really interesting. Or, I have a couple of people who message me all the time off of this account that, are suffering from dry eyes, and I've posted something and they're like, oh, I'm going to try this drop, or, just kind of interesting things. And so mine's really like 80% of what I post is for the patient, and then about 20% is just personal or fun, or a little bit of self-promotion for my own business, like, hey, this is my business and what I do. And I know Stephanie, her Instagram account is probably a little more clinical than mine is, but awesome, and also looks really good. So I'm interested to hear what you have to say.
Yeah, so I'm like Katie, where I don't really enjoy social media. I don't really like posting on Facebook and Instagram. It's not something that I like. Some of my friends are like on it like every single second and posting like every single detail of their life. But I am not that way. I just don't have the time or energy. But I've been working actually with a business coach, and most of his clients are actually in real estate, but at the end of the day, we are all in the same thing, which is marketing. And one of his major things was, he said, you have absolutely got to start a Facebook page and an Instagram, Twitter, not so much. And then also YouTube, you need to have videos. And so in the beginning, I thought, okay, this is great. So I made my Dr. Stephanie Wu handle, and I was posting a lot of really cool case reports and things. And mostly that was to, I just thought the case reports are really interesting and showing kind of the value of some of the different technologies that we have out there. And that was mostly geared for other practitioners. I just thought that since my type of clinic is going to become mainly referrals from other doctors, I need to have some sort of a presence where if they do find me on some of these social media platforms, they'll see like, oh wow, Dr. Wu really knows what she's doing. She can help a lot of these really complicated cases. But now I've also developed another social media platform, which is the Contact Lens Institute. And that is more like Katie's approach, where it's very geared toward patients, layman's terms, things like that. And something that my business coach has taught me is, if you think that everybody knows it, they absolutely don't. And I think that has been very valuable. So I will post things again and again about the same topic. And even though I'm like, oh my God, I can't believe I'm posting on this again. This is so, I wonder if people are getting really tired from it. But I always get feedback on it. And like Katie, I've gotten patients from all over, just from Instagram. They'll message me and because they've read all my posts and they see kind of what patients I help, and they will travel from all over just to come see me, which is so humbling that patients would be willing to travel so far just to come see me. But I think that just kind of shows the importance of having some sort of a presence, not only on social media, but like Greg said, developing lectures, coming up with different articles or content for your website. So the more that you can do to show other doctors and patients that you know what you're doing and you're good at what you do, the better. And that definitely will help build confidence all around.
I wanted to just add something real quick, in that I really want to emphasize to students that this is something you can do right now. If you are interested in scleral lenses and you want to become an expert and learn more, if you just post what you know now and you find it very interesting, then you can do it right now. And that's something that if you have 200 posts in the future, people are going to see that, and that's going to be really beneficial for you. You don't have to wait until you know everything to start out.
Very true. So shifting gears, let's talk about kind of some of the nuts and bolts. It's not the sexy part of fitting sclerals, but it's very critical to your success in streamlining the scleral lens fitting process. And that's, what do you need in place in your office to really start seeing these patients, and how do you get them through the office in a timely fashion? So, Greg, I want to start by asking, what role at this point is your staff involved? I mean, are you having them, involved in actually some of the fitting process, or are they mainly there for support and patient education, and kind of how you've developed their role over time?
Well, the way I do things might be a little bit different, because I have one full-time assistant that is literally my right-hand helper. I can't imagine not having her available, because she does so many things that are important to the process that are necessary. And so, but mostly what she does is on the administrative side. So of course she helps out with scheduling. She helps out with the billing, which includes going through the patient's insurance, payment options, different plans that they can use in order to help pay for the cost of both the fitting of the scleral contact lenses as well as the material fees. She's super knowledgeable about helping patients over the phone and via email. So even when I'm not seeing patients, I'm in my office, I can hear her. She's on the phone all day with these patients, and she's very good and over time with education about troubleshooting the most common questions, the most common complications, many of which can be handled right over the phone, and that I don't even have to be involved in. And she has the good sense to know, though, when something is above, her experience level, and then she'll get me involved, or obviously we'll have the patients back in. She's involved with all the lens orders, returns, reorders. So in my mind, especially for specialty lenses and scleral contact lenses, if you can have one key person at least, you might have a few, but one really key person that is knowledgeable, I think that goes a long way. And then, of course, I know probably most practitioners have high qualified technicians that are part of the fitting process. They may even put lenses on. They may over refract. They maybe do the training. From a clinical standpoint, I don't know if it's just how I started, but I have my hands in everything clinically. So we fit patients using corneal scleral topography. So I do that measurement myself because essentially that's taking care of the fitting process. So I want that to be as perfect as it can. And I put the lens on for over refraction. When we dispense the lens, I dispense it, and I also do my own application removal training because to me, that's such an important step. I mean, you can go through all the work and fit the best scleral contact lens that's perfect for the patient's eye, but if they can't put it in properly or take it out or have trouble, then all that work is for nothing. And just from my end, I think a technician can definitely do it who's trained. But I have so much experience with it, and I'm very efficient and skilled with it that, to me, I just do it myself pretty much. And then my assistant takes over from there with checkout and all that. So for me, that's how that's worked well. But I'll be interested to hear Dr. Wu's and Dr. Morrison's methodologies.
So on that note, Dr. Wu, in addition to having a dedicated staff as your primary assistant, how critical is it to have everybody on your staff on board with and at least partially knowledgeable with what you're doing, especially in terms of like scheduling? I know, originally when you started, you were mixing in primary care and scleral lenses. Were you doing that? Were you dedicating time solely to specialty lenses and sclerals, or were you mixing it in with your primary care day? And do you have any tips for maximizing that? Because not everybody is going to be coming out and starting their own scleral lens only practice, so they'll have to mix in regular care.
Yeah, absolutely. So I see from the polls that most of the people on the webinar are either really recent graduates or getting very close to graduating, or they're already practicing. So you're probably, already in a practice, or you have a practice that you're going to be joining. And I would say that first, you have to educate the staff so that they know some of the terms and some of the things you're doing. That was really critical to when I first started implementing specialty lenses. We would have weekly staff meetings for like an hour on like Friday mornings or whatever. And we would talk about some of the new things. And in the beginning, when I first joined, it was really important for me to be able to educate the staff on some of these different cases, because these are types of cases and different conditions that they have never heard of before. So when a patient calls and they say, I have keratoconus, can you help me? The worst thing that can happen is the staff member saying, I'm not sure, like, how do you spell that? Let me try to find out for you. That's terrible. So we wanted to make sure everybody was on the same page in the beginning. And because nobody knew anything about specialty lenses, I had to do everything myself. So like Greg was saying, I took all of my own imaging. I put the scleral lenses in the patient's eye. I did everything. I ordered the lenses. I handled all the returns. I even did the billing and coding because the billers and coders didn't know how to do this. So until we did this enough and people got more comfortable, I was doing everything myself. Now, that being said, I was also seeing about 30 to 50 patients a day. And so that is a tremendous amount of patients. So I ended up having to figure out how else can I have staff help me, because I can't be spending 2 hours with a patient figuring everything out when we've got like 30 employees. I mean, it's kind of silly. So what ended up happening is I ended up teaching one technician how to do everything really well. So they would know how to take the case history. They know what questions I wanted to ask. They knew how to put the lenses in, take them out, do all of the imaging, all of that kind of stuff. And then I worked with the billing department, and then they got more comfortable billing and coding. So we had not just one person, how like Greg does, but we have like multiple people that are involved in specialty lenses now, but it took some time to get there. But I would say for a tip on scheduling, so since most of you guys are already working and you're probably seeing patients, you know, in like a private practice setting or a setting where you're doing lots of comprehensive exams and other things, I would say if this is something that you are really going to commit to, then you should make space in your schedule, let's say once a week. So for me, it was Tuesdays. I think it was at 11 a.m., 11 to noon. No patients go there except for specialty lens consults, fittings, follow-ups. That's it. Nothing else can go in this time slot. And so that would encourage me and the staff, because the staff don't want to be sitting around doing nothing. So they would help me as well. And we would make sure that that slot on Tuesday only was for a specialty lens patient. And then what ended up happening is, okay, that got full. Now Tuesday and Thursday from 11 to noon, only specialty lens patients. And if I didn't have a patient, or let's say somebody canceled at the last minute, I would do exactly what Greg said to do. I would work on articles. I would educate myself. I would read. I would just try to become more of an expert in that scleral lens or specialty lens field, reviewing some of my old books from like optometry school on corneal GPs and different lens types, just trying to still continue to become an expert in this field. But I think that was a really great way to start. So if you are working for another company, just kind of ask them, hey, can I have this 1 hour, and that's only going to be specialty lens patients. And then eventually, as you progress and see more people, you'll open up more time slots.
And then Dr. Morrison, so on the last slide, we had a little bit about supplies, but you know, being in a new practice, what are you guys, or what are you using, and what supplies do you find that you need on hand to be, you know, effective with fitting sclerals? And also, what are you handing out to patients? We have a couple examples on this slide, which is some paperwork, one of which from my office and the other one's from Sclera Lenses, or from the Sclera Lens website. In terms of, you know, we hand out consents, which detail the fitting process, costs, and then, you know, other educational information for the patients. But what are you using and implementing in your office in terms of supplies for the patient and information for the patient?
Yeah, so I have this on the handout that you'll get at the end with specifics as well. But basically, obviously, you need a scleral lens fitting set. And if you don't know which one to get, we'll talk about that a little bit later. Saline solution to fill, insertion and removal plungers, and cleaning solution. One of the great tips that I had was that Boston Advance is a fabulous solution to have to clean the lenses when they come from the lab in your fitting sets. The way that they're packaged and shipped to you, it's just when you put them on the person's eye, you might get a wetting problem on the front. So if you can just rub them with Boston Advance right when you get them, that'll save you a lot of time and headache. And you can over refract a lot better. So basic supplies, I mean, the fluorescein you guys already have. So pretty easy stuff that I honestly got most of it on Amazon when I was first starting out, and now I have other ways of getting it, but got it on Amazon at first. And then when each patient comes in, we'll go over a scleral lens agreement, which is kind of this patient information form. The agreement will go through our 3 months of being together, the warranty period, what we're going to be doing, what happens if a patient wants a refund, how much the procedure and lenses are going to cost them, and then basically just some information about sclerals in general, and then they sign at the bottom. So we're all in agreement about everything moving forward. That's super important. And then I did create a little handout to give to patients as well about everything you need for scleral lens care. So all the solutions that I want you to be using, I have everybody using ClearCare. That's just like a stickler of, it's like I'm a big stickler on that. ClearCare, and then certain solutions, I use a lot of HydroPeg, so you can only have certain solutions with the HydroPeg. It's a coating on the lenses. And then at the bottom of the care sheet, it will say, everybody who leaves my office, they will have a portal on my website. I log in every single thing on their portal, insertion plunger, removal plunger. This solution is for that. So then they can just log on and see everything that I've recommended for them, and then they can order that on my website or elsewhere. It doesn't matter. It's just that they have it to always see, so they're not like, oh, wow, I forgot that piece of paper. And that's been really helpful, for me.
Great. On a similar note, shifting more towards, what equipment do you need? One of the questions I think that's always asked, in lectures and when I talk to students is, what fitting sets should you have to start seeing patients? Because there's, at least a dozen labs. They all have one or two designs. How did you go about choosing, which fitting sets to incorporate into your practice?
Well, I think that can be practitioner preference for sure, but there's lots of different designs out there and available. There's lots of labs that have great manufacturing, have great customer service. And so I think, maybe even going to meetings and getting to know some of those folks is one way to go about trying to figure out sets. I think it could be a mistake to go out and get 6 different fitting sets, because that can be quite confusing. And I remember early on in my career listening to Alan Sachs from New Zealand talk about fitting corneal gas perm contact lenses for keratoconus. And one of his pieces of advice for the lecture was to get to know one set really well, because once you know that design really well, then it's going to be easier for you to make adjustments or to understand the adjustments from the consultants and move from there. So it may be helpful to have a couple different sets depending on the patient's case, but I think knowing one design well makes a big difference. And getting back to, there are lots of good designs out there. Just as an important factor in your decision process is the relationship you have with your lab. And so that involves customer service, that involves manufacturing, and everything else that's included in the package of ordering and having a lens sent to your practice. So I think that's an important component of even choosing which design to use.
And then in terms of equipment, that's another big question, which is, what do I absolutely need to fit a lens? And I think, obviously topography is crucial, at least for the diagnosis and management of an ocular condition, particularly corneal ectasias. But of this list, is there anything on here that, any of you identify as absolutely necessary versus, a luxury to have in terms of managing your patients?
I agree with you, Rob. I think that topography is critical. If you want to do anything with specialty lenses, I think that is really important, not only for diagnosing the patient, but for a lot of these cases, you're managing the underlying disease, right? So if they have keratoconus, you want to see if they're advancing. If they've got some sort of scar, you want to make sure that there's no changes in elevation. Maybe they have a condition where their endothelium is you know, there's something going on there, so you want to check the thickness. So I definitely think a topographer is essential, but I will say that in my original practice, we ended up getting to the point where I was like, we absolutely have to have a pentacam. That's, you know, we're managing so much keratoconus and other things. It's really the gold standard. So with my new practice, being a startup company, I had a budget. So I can't just go out and buy the absolute best of the best, everything that I've had in the past, because I'm starting it, I'm funding it myself. And I really had to make a list of must-haves versus would be nice. So I really wanted a pentacam, but for the amount of money it cost, that would have eaten up like 30% of my entire budget. So I ended up going with a topographer that was way less expensive. And there's nothing wrong with that. I can always get a pentacam in 6 months or a year or 2 years or however long it takes me. You don't absolutely have to have the best thing and the most expensive thing. That's absolutely not necessary. I know that both Katie and I, when we were sharing our lists of, okay, what do you need? What do we not need? And yeah, for me, it was for sure I needed a topographer. I definitely wanted an OCT. I think that is absolutely critical for fitting scleral lenses. I mean, I've even tested myself of writing down how much I think the central clearance is by comparing the center thickness of the lens to the tear film. I'm always off. I'm never as accurate as an OCT. So I think an OCT is critical. Anterior segment camera, I didn't have that for the longest time in my original practice, but what I would do is take some photos with my camera, my iPhone, and I would just hold it to one of the oculars. I didn't have any adapters or anything. I just got used to where the optics were, so I was able to capture a photo so I could show patients. And but for my new clinic, that was something where I said I absolutely have to have it. So if I was going to spend the extra money, it ended up being for an anterior segment system where I can take photos, videos, fluorescein photos and videos, because that is, I think, super helpful for not only patient education, but also when you're communicating with the laboratory. So when you're saying, I'm seeing compression here and here, they may not know, well, how much? Is it a lot, a little? So it will really help them to help you. So I definitely think that's absolutely critical. As far as a Sclera Profiler, in my other practice, it wasn't something that I wanted to spend the money on. I just thought that I was really good at what I did, and that was more for novice fitters. But after I got one, now there's absolutely no way I can go without it. I mean, the information that you get, and I know that Greg will for sure agree with me, that the information you get from a Scleral Profiler is absolutely amazing. And I feel like that probably will become the gold standard if you are going to fit scleral lenses at a high level. If you're only doing it, you know, once a month, or if that's what your intention is, only just to help the patients that you're helping in your office, and you're not going to be doing this a ton, I don't think it's something you absolutely have to have. Maybe Katie or Greg will disagree. Specular microscopy I had in my other clinic. I don't have it in my new one yet because, once again, I ran out of money. And then I do have an aberrometer in my office because I felt like, because I'm trying to identify myself as an expert and offering technology that no other doctor has in the whole state of Nevada, I felt like that was something that I wanted to spend the extra money on. So those are just the things that I feel that are essential, but I would love to hear from Katie and Greg on what you guys agree with or totally disagree with.
I would add one thing real quick. You know, if you don't have access to it in your own clinic, for example, I also don't have a specular microscopy, an endothelial cell count. So, but I'll send them to my partners in ophthalmology and just send them over for the test, and they'll run the test and send the results back to me, and they don't need to see the patient and all. And so we can still manage it even if you don't have access to it. So
great advice.
Those relationships. But Dr. Morrison, did you have anything to add before we kind of move on?
Yeah, I mean, I would echo with what Stephanie said as well. I was pretty much looking at how can I get the most bang for my buck, and also starting a cold start practice. And I love the Pentacam, and it comes with a Sclera Profiler software. So that was kind of a 2-in-1 machine where I didn't have to buy separate machines of both. I could have them both on one. I would just have to teach myself, you know, how to use the software. The OCT I did think was really crucial, and patients are really wowed by the anterior segment camera. Even if you do it on your phone, you can get an attachment, do it on your phone, like Stephanie was saying. But they really like pictures and they think it's really high tech. The aberrometer would be something I would consider. If you're in a practice with ophthalmology and they're doing LASIK, they probably have an aberrometer. So maybe you would want to choose a fitting set for the scleral lenses that could incorporate wavefront aberrometry, because that would be something that you already had in your practice, that you could just kind of 2-in-1 and get that extra special scleral lens fit.
Agreed. So just before we kind of wrap up, I wanted to talk about one quick thing real quick, which of course, you know, we could spend 10 hours talking about billing and coding, and so we don't have the time tonight. But I wanted to just go over a few basic concepts to consider, you know, when you're thinking about fitting lenses. How do you decide, you know, should you accept insurance? Should you be private pay? If you already take insurances, that kind of muddies the water. And then a little bit about medical necessity. So I'll turn it over to Dr. Wu, and then after this, we'll kind of answer a couple questions and wrap up.
Yeah, so I think that insurance versus private pay, that's something that you really need to get crystal clear right away. And I would say probably most people on this call accept insurance. And so that's something that you need to look into, because if you are contracted with a medical insurance, let's just say Blue Cross Blue Shield, they have specific payment contracted amounts for certain codes. So if you are using the scleral lens fitting code and the scleral lens device, they have a contracted rate already that they will pay you. So that was something that that we had to have a conversation of, and that's why now in my new clinic I decided to go without insurance. But most people on this call are not going to go that route, so I won't really talk to that. But I think it's really important to figure out their benefits before they arrive. So what my other clinic does is that when the patient calls, is they will get all of their benefits from their medical and their vision insurance. That way, when I go in to see the patient, I know exactly what their insurance is going to cover either way. And so then we can have that conversation of, oh, okay, well, your vision insurance is covering this, and we can go down that route. But like Rob said, it's super important to understand what is considered medically necessary. And most vision insurances lay this out pretty easily. It's pretty easy to understand. It's in your online manual or your contract, and it actually has some of these pictures that Rob has shown, and it actually says what qualifies. And the important thing is, it is not the same across the board. So somebody that has anisometropia might be 8 diopters in one, for one company, it could be 3 diopters in one company. So it's really important to not get super comfortable with, oh, okay, I know exactly that this insurance is going to cover, because every single plan is different. So you need to make sure you print that out and review that before you kind of go down that route. Because the worst thing it can happen is you say, oh yeah, everything's covered, it's a $20 copay, and then, you know, a month later you get rejected because the prescription wasn't high enough. Then it's kind of back on the patient, and then they have to pay, which is they're always upset about. So I think, yeah, just making sure that you know what's going on with your vision plans. It's all pretty clearly laid out. And then if you are doing medical, find out what your contracted rates are, because some of them are very poor and sometimes don't even cover the cost of the lens itself. So that's definitely something to look into. And there's lots of resources out there, I think, that could be valuable.
Yeah. So, and then just to kind of wrap up on this topic, Dr. DeNaeyer, being in a ophthalmology practice, I would assume you're probably not even accepting any vision plans. But do you have to, are you billing to medical insurances, and how do you sort of kind of manage that? Or are you just billing visits basically kind of a la carte?
No, actually what we did, or what we do, is that when I first see a patient for potentially fitting them with specialty lenses, scleral contact lenses, I see them as a patient first. I never do the fit on the same day that I see them the first time. So that is just an examination to maybe make sure that they indeed have keratoconus or whatever else, so that they're actually a candidate. And if they are, then this is where they will meet with my assistant, and she will go through everything with regarding insurance. I do accept one vision plan, and we do utilize it when the patient has that available. We do also submit for medically necessary lenses as well. And then for those patients where they may not qualify for either of those avenues, then they, I think Dr. Morrison had touched upon this, that we talk about payment. They make sure that they know exactly how much they're going to be paying, what the warranties are. Sometimes patients will just pay up front, which is great. And we've also come up with a payment plan for them as well that they can do for about 6 months of time. And that seems to work out real well. But we try to get all of that cleared up out of the way first before we even start the fitting process.
Great. Well, we're running short on time, so I wanted to wrap up. Dr. Wu and Dr. Morrison both have kind of some checklists and some tips that we can send out. So if anybody's interested, just email me after the webinar, and I can email you out these lists, and you can have them for to read over. And then lastly, I think there's a few questions that we didn't quite get to within the presentation, but I can't read them, so I was going to let Stephanie read them for me and see if we have any questions.
Sure. So there's a bunch of ones that I kind of answered, but are there any online courses? So for Katie and Greg, are there online courses to learn more about contact lenses?
Yeah, GPLI is fabulous at doing this. Scleral Lens Education Society. You can go on any of these and find not only webinars, but troubleshooting fits, pictures of what to look for. We had answered some questions about, how do you get to that place where you might become considered, an expert of fitting these lenses. And basically it's just go on all these websites and watch everything that you can, and really educate yourself. And the more that you can know, it's all out there. Get on some Facebook groups that we have as well are great to learn from other practitioners. Scleral Lens practitioners Facebook group and different ones like that are really helpful. Just listen to what people are saying.
Great. I have one for you, Rob.
Sure.
I'm an optometry student looking into residency. I want to work with specialty lenses in the future. I'm conflicted on whether to pursue a specific cornea and contact lens residency or a more diverse ocular disease residency. Do you have any input on this, or does it matter in the end?
That's a great question. And I think, a lot of it depends on, what the experience you're trying to get out of your residency is. If contact lenses, specifically scleral lenses and specialty lenses, is your primary focus, then I would shoot for a cornea and contact lens residency, because you'll be doing that all day, every day. That being said, as scleral lenses become more popular, there's a lot of great anterior segment and disease residencies that incorporate scleral lenses. And of course, you could even get started on your own without a residency, but you have to find a practice that is willing to let you learn the ropes as you go, because it can be, in a way, costly to not just time that you're dedicating to learning, but also money to your practice, where, at least in a residency environment, there's I think a little bit more leeway and a little bit more mentorship and guidance in addition to being able to, go and participate at all the major meetings, that provide more education. So I'd encourage you to just ask the residency directors, what their focus is. They'll tell you, roughly what type of patients and how many they're seeing. They'll put you in touch with the residents that are currently there. So that's the best advice I could give, is try, what type of practice you want to do when you get out, and then go from there. And then to touch on what Dr. Morrison was saying, a lot of the specific labs have webinars, especially these days when we're all cooped up at home, with webinars every night. There's a lot of content from your specific lab. So if you're already, working with a lab, or you have an idea of who you want to partner with, they will more than likely have webinars to teach you the intricacies of their specific design or equipment. So again, there's no shortage of educational information out there. Are there any other questions just for any of the panelists before we kind of wrap up? I know we ran a little long, but I appreciate you all spending your time, especially for the students, because I believe some of you are still doing finals. So good luck with that. But were there any last minute questions?
There's just a couple questions about like billing things.
Yeah, that can be very specific. So I'd recommend shooting an email after the webinar. We can try to address it, because there's also the GPLI has a great webinar by Dr. Newman on billing and coding. And then I believe there's a sort of a entry-level billing and coding on the Sclera Lens Society from a year or two ago. But it can be very dependent on where you practice and what type of practice. So feel free to shoot those questions via email. We'll do our best to answer them after. So I guess with that, I'd like to thank our panelists, Dr. Wu, Dr. Morrison, and Dr. DeNaeyer, and then everybody for being on this webinar tonight and spending your time with us. So with that, we will end this webinar. So thank you.
Thanks, everyone.
Thanks,
Bye.
everyone. Appreciate it. Take care.